Welcome to the KVARA Podcast, where we have a series on anything and everything you need to know in the prenatal and postpartum period, commonly referred to as the fourth trimester. Stay tuned. Welcome back to KVARA, our podcast. This series is on pelvic floor physical therapy, and we welcome back Dr. Desiree Pabin, who you met in the last episode, and we've got another topic to discuss here today.
So today's continuation of our last episode was talking about common postpartum pain, and we talked about perinatal pain, we talked about C-section pain, and we gave a boatload of life hacks and things that you probably didn't realize you wanted to know regarding it. So if you haven't checked it out, please go listen to us talk about that. We're wildly entertaining. So then today's episode is continued entertainment with, we're talking about all the multiple things that you might have experienced while you were growing your tiny human. And when they popped out, it may not have spontaneously resolved, right?
Right, absolutely.
So things like pain up in your upper back, rib pain or thoracic spine pain, generalized abdominal pain, not C-section scar pain, pubic symphysis pain, sciatica, and SI pain.
Right. All super common things that, probably most of you will experience, and it'd be really nice to have a few life hacks or at least information to talk about. And what's really cool is that we're going to have three different perspectives here today. One from an OBGYN who maybe not much of a perspective.
You'll be helpful in your own way. I'm excited.
Two, we're actually going to have a patient that we actually mentioned in one of our previous podcasts. I met Dr. Pabin because she took care of my wife with one of these exact types of pain during pregnancy and then again postpartum, and it helped immensely. And then the third perspective is you're actually going to get to meet my wife and see how it helped her, which is the most important of this whole conversation.
Yes.
Yeah. So we'll address each one of these things, and hopefully it helps, all of you, in the process.
So they all kind of fall under a similar umbrella of oftentimes there's kind of like an instability component, right? So when you're growing tiny humans, your body at some point in pregnancy, second-ish trimester, your abdominals lose the advantage to work in to stabilize your spine, right? And baby starts getting heavy and things start getting pulled on, and your body actually starts using the pressure inside your abdomen from tiny human to get stability rather than being able to pull in and stabilize your spine that way. That can affect all sorts of things, but once baby comes out, sometimes you can end up with additional rib pain or this feeling of like loosey-goosiness, right?
Right.
Yes, and so you end up feeling kind of like all over the place. You feel loosey-goosey, and because you don't have that internal stability, suddenly baby pops out and your body has to do what it hasn't been able to do, and it likely is deconditioned from growing this tiny human.
Right.
So that's my plug for why it's very important to exercise all through your pregnancy. Come find somebody like me, and this will be a future episode. But if you're currently experiencing any of this, go find somebody like a pelvic floor PT, and we can fix this.
Yeah, please watch this podcast, get a little information, find Dr. Pabin or somebody like her if you're not in the Temecula Valley area.
Right.
It's super important. All throughout pregnancy, besides the anatomic changes, right? You're growing this tiny human, your rectus muscles and everything is stretched. The hormones of pregnancy that help relax it, it's actually called relaxin, right? So these things totally change your posture, pelvic floor. So we totally need to address these things, and it's super, super important. That's why we're so glad you're here.
Well, thank you. Okay, like I said, I love talking about this stuff. Okay, so what can we do? Well, so first, we talked about in the last episode that if you had a vaginal delivery, you can wear an abdominal binder for up to 3 days. That can help with not only maybe generalized abdominal discomfort you might be having, but it can help give you some stability in your upper back and your rib cage. Right. So that's one of the down and dirty quick tips. Great, do that.
Yeah, you should be able to get one of those from the hospital. We commonly supply them.
I was going to say there's some brands linked on my website, illumipelvichealth.com, if you go there, and there's some vetted ones from a pelvic health PT. Other things that might be causing pain is you have multiple abdominal muscles. You have 4 of them. The external obliques sometimes often become overactive because the deeper muscles are too stretched out. Right. And so sometimes you get it similar to round ligament pain, but baby's out, so it's not your round ligament, right? It's this like stabby, shooty pain that's coming like off to the side, like really fit men that V that they have, right? That's called your external oblique. And so that muscle sometimes is like gripping for you, trying to do the work of your pelvic floor as well as your other deeper abdominal muscles.
Right.
That actually can become a dysfunction later that can contribute to stress incontinence. So trying to hit that early and reduce that pain. But that would be pain that you have like if you try to jackknife and sit straight up out of bed, or if you roll over and then something grips and spasms up your spine. Those are going to be the kind of things, and you get this painful sharp catch and you're like, WTF, right? But it's on the abdomen. That's looking at external oblique overactivity. You need to recoordinate your pelvic floor. We can fix that.
Right. And stress incontinence for those of you that don't know the term.
Sorry.
Yeah. And so sometimes, we talk and like we're at our job and we forget. So stress incontinence, there's a large percentage of you that actually experience it, but it's a really fancy term, when you cough or laugh or sneeze, you leak a little bit of urine. Mm-hmm. It happens pretty commonly. Mm-hmm. But Dr. Pabin is a perfect person to help fix those things. But just to kind of clarify, if maybe you didn't know what that fancy term was.
Yeah. Sorry, I'm speaking gibberish. Okay, so we that's the abdominal, that's the thoracic spine. Some common little symptoms of that and where it's coming from.
Right.
Then we have SI dysfunction, sciatica, and pubic symphysis pain. So if pubic symphysis pain is that pain like dead center on your bone, oftentimes that's you stand on one leg and you get this sharp pain. Sometimes it runs up your groin.
Right. That little bone that you feel right down there, kind of well below your belly button, but right there.
Mm-hmm. So that can be painful. And then directly in the back and kind of off to the side are your SI joints. And so that's often a pinch, a catch. That can be pain, sitting, standing, walking, oftentimes like getting in and out of the car, all of those things.
Right.
So what can you do about it? Great question. You can work on trying to engage your core. You can strengthen the muscles around it.
Right.
So in English, how do you engage your core? Mm-hmm. Okay, we're going to talk through. You can do this in the car. If you're in the car, if you're anything like me, the only time you get peace is when you're in the car driving. So if you're in the car, we're going to try this right now. Okay, so how do you engage your deep core? What you do is you breathe in, you breathe out. As you breathe out, you try to pull your low abdominals in and your pelvic floor up while you exhale. So your pelvic floor, meaning pull your rectum up inside your body, okay? And your deep low abdominals, you should pull them in toward your spine. Now, we are not doing like a crunch. If you're feeling anything up high near your rib cage, activate, did it wrong. Sorry, boo.
Right.
Okay.
It's like if you're trying to hold a fart in that church and you're trying to...
Note it. Okay, solid. Well, so yes, that for the Kegel, you got that right. Yes, right on. You're such a guy now.
People understand.
They do. And I'll give you credit. And then honestly, the missing piece usually ends up being the deep core, like the transverse abdominis component. And that is probably what I spend most of my time cueing people on. And once they find it, they know they found it, right?
Right.
So if you're like, boo, like I'm 2 weeks postpartum and I'm just listening to this, or I'm 37 weeks pregnant, as if, valid, okay? Totally valid. What I want you to focus on is just trying to get that breath with that lifting your rectum, like pulling up your pelvic floor, because automatically your transverse abdominis kicks in. You can't undo that.
Right.
Okay. So breathe in, you breathe out. As you breathe out, chase the air out of your lungs by pulling your rectum up into your body. Right. And see if you can get your core to pull in from low at the same time. Okay. What is that going to do? It's going to help stabilize that pubic symphysis in the front. It's going to help stabilize that SI in the back. And as you stabilize that, it's going to help with some of that poor recruitment of the abdominal wall that might be giving you that sharp external oblique pain. And it's going to help stabilize your thoracic spine. We fixed all the things starting with that one exercise.
All of them. And you can do it while you're driving.
Right. You know while you're driving.
I think you always recommended with my wife at a red light, right?
Yeah.
You stop at a red light. You're there for 2 or 3 minutes. Mm-hmm. You got nothing else to do. Mm-hmm. Stabilize your pelvic floor.
Right. At least.
Most women should do.
At least to get it going. And that's specifically if you're weak. I highly recommend, this is my soapbox and my plug, get an assessment. Get an intro assessment by a pelvic floor PT. I love my OBGYNs, but the training that they have in actually assessing the function and the motor control of the muscles, you just don't have the space in your training to learn it.
Right.
And so that's why you send to somebody like me, and we make sure that that's the problem of weakness rather than tightness and overactivity.
Right.
But if you're experiencing these things and you just need something and you want to try it, Try it for a couple weeks. If it helps, great. If it makes it worse, pause and come find a PT. Other things for SI pain and pubic symphysis pain is basic stretching. Butterfly stretches, gentle, right? We're not doing crazy things, but oftentimes your groin is tight and overactive. Your piriformis is tight and overactive.
Right.
Everything's kind of locked down because you're loosey-goosey from that relaxant.
Right.
That's the terms. And your nervous system just goes, oh my gosh, this is really important. Lock down and hold. And that then can create dysfunction and pain.
Right.
So gentle butterfly stretching, you can do it laying down on your back. So lay on your back, do your bottom of your feet together, let your knees fall out wide. If that's uncomfortable, put pillows underneath your knees, and then do belly breathing. Connect to your core in that position.
Right. It's kind of like the same movement, the butterfly. That's actually like when you're in the hospital and we do cervical checks. That's exactly what we call it. So if you're, if you haven't seen it and you're not familiar, this is exactly what this is.
Lotus pose for my yogis out there. Yes. And then I was at piriformis stretch. Whatever your most favorite piriformis stretch is, I genuinely don't care. You can YouTube it. Maybe we'll create content that they can link back to your YouTube for.
Yeah, absolutely.
And so a piriformis stretch, and honestly, the bread and butter of this is try to work on that breath and getting your pelvic floor to kick up and in. Do some stretches to get your groin and your piriformis to calm down. And then you can do things like get pelvic support bands. They have maternity ones. Again, you can go to my website and there will be linked brands that I generally recommend to patients. It is also acceptable to wear the SI belt postpartum. So if you went into the hospital and had dysfunction, take it if you remember it. No judgment if you don't.
Right.
If you remember, take it with you because I want you up and moving in that hospital like you were talking about you recommend. And I don't want that to be a limiting factor for you.
Right. Yeah. We definitely want you up and moving. And then the little donut, I think you had recommended to my wife the little donut pillow, right?
Mm-hmm.
What's the proper term for it? Is it a little donut pillow?
I mean, yeah.
Donut cushion.
Yeah.
It really helps take off the pressure off of that SI joint. And if you do have sciatica or, pain there, SI joint dysfunction, it's super, super helpful. It's really wild that, it's not something commonly talked about. And we had to actually go and find you and get these recommendations to go find a donut pillow. Really, you should just be able to go buy one from Amazon or your website.
Right. Yeah. I'll link that too. We talked about in the last episode. LifeWax is the airplane neck pillow.
Yeah.
You can buy a specific perineal. It's a coccyx cushion. Could be a term that you look for, although that's not really its purpose for this situation.
Right.
Same difference.
Right.
Or you can roll up a jacket into a U shape just to kind of help support and offload.
Right. Right. Super important. These things are really helpful. And, we can hear directly, like we said, for, my wife who actually had a lot of these problems and kind of her experience as a patient, you don't want to hear it from me. Who am I?
You matter.
So just like we discussed recently, we're going to have Amy, who's actually my wife, who was a patient of Dr. Pabin. We're going to hear it straight from, ground zero and let her kind of discuss her experience with Dr. Pabin and the little things that helped.
Okay, this is Amy. Amy is Dr. Carnevale's wife. She was a patient of mine what seems like forever ago.
Yes.
2 babies for you ago.
Yes, 2 babies now. Yeah.
And she came to me and she had pretty significant SI pain. You had to go off work.
Yes, I did. I was working as a CNA at the hospital.
Lifting
200-pound patients was no longer in my wheelhouse. There was no way. So yeah, I went to my OB, Dr. Courtney Martin, and
I adore her.
Oh, she's phenomenal.
I credit her with diagnosing my postpartum depression. A tangent. I'm sorry.
It's okay.
Amazing.
Yeah, she's a remarkable woman.
Yes.
She really is. So, and I was so grateful that she led me to you because there were days, it was debilitating. Yes. And I had been, this was not my first rodeo as a mom. I had 2 prior babies.
And did you have this with them?
No.
This was new.
Yeah, it was new. It was an onset issue that I was really just taken aback by because it was humbling, to say the least, to go through 2 pregnancies where I was that obnoxious woman who's like, I love being pregnant. This is great.
She does rebound beautifully, for the record. So she still kind of is, but Okay, continue.
So, I mean, there was, I think the first initial realization of what was going on was I tried getting out of bed and just opening my, like, you know how you turn over to get out of bed, your legs kind of naturally open to move over. I felt like, I just kept telling Kevin, it felt like I was breaking at my SI joint.
I remember that.
Yeah. It just was the wildest thing because, again, I had never had any issues before this. And I want to say I was about 20 weeks in. I was about halfway through my pregnancy when this happened. And I was like, what is going on? This cannot be how I do the next 20 weeks. So yeah, so then Dr. Martin, I want to say we tried a couple injections first.
I was saying, you came to me after doing injections, and I was like, you're pregnant. They did injections? Okay.
Yes.
Okay.
Yeah, we did try a couple injections. But it still just, as you know, was just a Band-Aid, right? That wasn't going to fix my problem ultimately.
So what were the biggest things in PT or lifestyle changes, whether you learned it elsewhere or from me, that you did that you felt were instant changes for you? And then what made the difference kind of long term? Because you didn't have it with the next baby, right?
I did not. No.
Okay.
No.
So what are the biggest things that you learned or did or found that made the biggest changes for you, like that you could tell somebody day one, try this and see if it helps?
I would say for sure, just your strengthening exercises. Strengthen. I felt like the more of those supporting muscles were doing their job supporting, it was just lessening the pain of the SI joint issues that I was having. So that's my number one takeaway.
Did you use any belts? Did you find that helpful?
You did offer me a belt, which I did end up using, especially if I knew I was going to be really active. I would bring the belts, into the picture. So yeah, that was great.
Okay, so strengthening the bejesus. I actually had a patient not too long ago, and she's like, pain's a really good motivator for me because I figured out when I have pain is when I do my exercise.
Yes, it's true.
And I'm like, okay, well, I guess whatever motivates you, right? And so just like as a side note, if you are prone to, you have like back pain, SI pain, even pre-growing tiny humans, or one pregnancy you were fine, relaxin is a kind of a cumulative effect. So with baby number one, your ligaments don't necessarily go back to where they were before you ever grew a human. And you might be a little bit looser. So I've had patients who are on pregnancy 2, 3, 7, and suddenly they get these symptoms, right? Yes. So trying to be as strong as humanly possible, which we will do in later podcasts that I commandeer, to give you a lot of the same things that I probably gave Amy forever ago that were a huge piece to her success. Okay. Belts were helpful when you're on your feet for a long time. Just to recap, exercising the bejesus out of things was huge.
Yes. So huge.
Did you have symptoms postpartum?
I did.
Oh, okay. Tell me.
I did.
Did I see you postpartum?
I don't think so.
Okay, yeah.
Because I would try to manage. I would do my best to just take the tools that you gave me and...
Well, and you had 3 at that time.
She was number 3, yeah.
Yeah, and so having time to come see me. Okay, so what'd you do?
So I would just kind of, again, continue on with your strengthening exercises. I would do as much stretching as possible. The boppy was amazing because I'd finish feeding her and then I would know it was going to take me a minute to get up from my seated position. So I'd set the boppy down, put her down safely on the couch, and then get up and try to do some exercises or some stretches to get myself back in a mobility position. Because going from sitting or like even sometimes just, when you breastfeed, sometimes you kind of lay back. Yeah. And just any of those positions would just trigger it. And so I'd have to bring myself back to a better place.
Okay, what were your go-to top strengthening exercises and your go-to top stretching exercises? Because I know if I was listening to this podcast, I'd be like, give me the goods. Like, what can I go home and try to do right now?
Yes. So I would say definitely like the clam, which was so painful at first. It was really hard to build up the ability to even do that because I believe you had me doing it with a resistance band.
Oh, I'm sure.
Yeah. So the clam was probably my top one.
Okay.
Because as painful as it was to start or to initiate that exercise, I would feel loads better after, like later on in the day. It would just set my day up for success, basically.
And as a side note, you can always YouTube. We will eventually have that content to have this video. But a clam is you lay on your side, you have both of your knees bent, and you're lifting your top leg up toward the ceiling without rolling back. right?
Yes.
So try to keep your pelvis facing forward out in front of you and lift your top knee. I hope that makes sense. And as with everything I harp, breathe, engage your core and your pelvic floor if you can. Okay, so clam, what else? So is there another strengthening and then stretches?
I would say strengthening. Another one was just with my core, engaging that abdominal muscle to really help support my back also. That was a big one. And then stretching, I would say the piriformis.
No, you did great. That was beautiful. You're good.
I would say that one helped me tremendously too.
What was your favorite piriformis stretch? Because there's so bazillions of them, and then it's like, yeah, but what's the good one, right? Do you remember?
Can I just show you?
Yeah. Okay. Let's try. I will attempt to articulate what's happening.
Like here.
Okay.
And this one, because it would just really.
Okay.
Is this not the piriformis?
That's not the piriformis, but if it helped you, I support your choices. I'm happy for you.
Okay, so whatever that one is.
Okay.
That's what helped.
Okay, so she was in like a half kneel. So she had one knee on the ground and one foot up like out in front of her as if she was like stepping up off the ground, lunging from her knees, right? Kind of.
Yeah.
And then she just pushed her and shifted her hip forward. What that would do is get a stretch and get a little bit of movement in that SI joint in the back. And for you probably were stuck on that side and your body was craving the ability to like jimmy rig it loose a little bit.
I think
and that's what you're facilitating.
I remember you would massage it a lot when I would come in
and get it to move.
Yes. So I think that was probably my main issue, was that it was stuck. Yeah.
Okay. Well, yeah, fantastic. See,
Yeah.
I love when patients know their body. Like if I can shut up long enough, patients generally tell me what's wrong with them.
Yes.
And then I just have to figure out how to tell them how to fix it. Yeah. So yes. Okay. And then just out of curiosity, how long did you deal with that pain postpartum?
I'd say at least 6 to 8 weeks.
Okay.
Yeah. It was a while. It was, yeah.
Do you still have any glimpses of that, or do you feel like you're recovered?
I do.
Okay.
I do, actually. There will be days where, again, clearly I probably need to exercise more. And I go back
I'm a PT. That's the answer to most things. Yes, continue. Please continue.
I go back to strengthening it, right? Because I do notice there will be days where it will feel not as severe, I will say. Not as severe, but when, let's say in pregnancy, I was at a 10, it'll be a good 6 or 7, some days.
Okay.
So, yeah.
Okay. Well, so this would be something for you to circle back to either my website or the podcast, and the information that we're going to have. There will be links on the YouTubes that we will build the exercises that Amy did that you could be doing. And really, these are things that optimal strength and just functioning of everything is really lifelong, because when you're momming, and you have 4 and you are active as all get out.
Yeah.
You have to have that to keep up with tiny humans, right? So take care of yourself, prioritize yourself always, because you cannot pour from an empty cup.
No.
I'm sure we'll have podcasts on that as well. Yes. So, okay. Is there any life hacks, words of wisdom that people who are experiencing this, if you're like, oh my gosh, you have this, please do this.
Yeah. I would just say, honestly, if you feel like something is off in your body, reach out to a specialist, because like you can't put money on how
health.
Yes.
Yeah.
Yeah. And how much better you can feel, because your pregnancy shouldn't be like that.
Shouldn't be pain.
No.
Nope.
Should not be painful.
Common does not mean normal.
Yes. And so you should be excited to be pregnant, and you shouldn't have this looming pain over your, pregnancy. So
I'm sure so many people can resonate with your story. Thank you very much for hanging out and for allowing me to take over.
Yes.
I got Kevin somewhere.
Of course.
All right. Well, thank you to my beautiful wife for giving her side of things, which I think is probably more important and the whole reason that we're here. Again, thank you to Dr. Pabin, who is amazing. We've had 2 really good podcasts already, and hopefully we're going to have a lot more. There's so many things to talk about postpartum, and then pelvic floor therapy. It's going to tie over into a lot of some of the fun topics, right? Like the big one, postpartum sex, sex during pregnancy.
Let's go, boo. I'm so excited.
It really needs to be addressed, and it'll be, I think, a lot more fun.
Everybody should orgasm if they want to orgasm. I'm excited.
I agree. Again, thank you for coming, and we look forward to more episodes.
Yep. Thank you for having me.
All right. Take care.